Hey, what's going on? So, I guess today, I am on to give an update about COVID-19. I'm going to share a few stats and answer any questions. So, if you have any questions, feel free to drop them in the comments. I do want to bring your attention to what I've pinned at the bottom of the live. So Whitman-Walker is still having free HIV and STI testing. That is available by appointment only. You can call 202-797-4439. And also COVID-19 testing is available as well. That is also appointment only. So for that, call 202-745-7000, or you can email appointments@whitmanwalker.org. Thank you all for joining me. Again, I'm going to give a COVID-19 update. But in the last few months, Whitman-Walker's Community Health Department has expanded its outreach efforts to social media, which is why I'm here talking about COVID-19. We cover various topics, though. Those topics could be HIV, STI sexual health practices, access to care, social determinants of health, and general public health interventions. So our series of outreach sessions right now have really focused on the current pandemic, COVID-19, and ways that you can manage your sexual, personal, and mental health during this time. Our community health team is always here to help, educate, and support you. Today, again, we're going to be talking about COVID-19. We are still in a pandemic, and it's been a little while since I've come on to talk about COVID. So I have some updates to give, so please buckle up. The information that I'll be sharing will be about cases, deaths, hospitalizations, vaccines, and variants. So I will have some extremely valuable information, not the best information to be discussing, but I'm here for you, and we're here for that. Hi, Lando. It's nice to see you. Thanks for joining. So since the virus actually reached the United States in early 2020, about 26 million people have tested positive for coronavirus, COVID-19, I should say. Because a large portion of infected people show no symptoms, and because we haven't always had the best testing system, the number of people who have been infected with coronavirus is likely much higher. So we know of 26 million people that have been identified as testing positive for coronavirus. The number of new cases recorded per day is still very high, especially in the DMV area. Just to put some numbers in perspective, the number of daily cases recorded in the United States on April 1st, 2020 was around 27,000. It stayed pretty steady over the summer, but started to climb around 80,000 by November 1st. On December 2020, it was about 184,000 cases, and in the beginning of January, we reached over 300,000 cases. And yesterday, as of February 1st, we logged 130,000 cases. The bottom line is that the pandemic is worsening, and it's worsening significantly since it started, particularly in these winter months. The caseload has actually been declining since we reached over 300,000 cases on January 8th. But let's not make any mistake. The level of community spread is still very high. As the infection rate has continuously climbed, so has the death rate. Since the virus has reached the United States in early 2020, 440,000 people have died of COVID-19. That's like if more than half of DC residents actually died in 1 year because of a single illness. So that is a lot of people, has had a huge impact on us as American citizens. So just like with the cases, the number of new daily deaths are extremely high as well. To put where we are today in perspective, the number of daily deaths as of mid-April 2020 was around 3,000 deaths per day. That decreased over the summer but started to climb again in the winter. On December 1st, it was back at around 3,000. So these winter months, we've jumped back up. Throughout December, January, and now we're in February, we have consistently logged days anywhere from 2,000 to 4,000 daily COVID-19 deaths. That's extremely high. Hospitalizations are also a big deal. I don't want to overload you with those numbers, but another data point to watch is the number of hospitalizations. There are currently around 100,000 Americans in the hospital right now because of COVID-19. The surge in hospitalizations means that very few emergency rooms and ICU beds are available in the U.S. We're stretching our clinical resources to treat COVID-19 right now, and we're stretching that really, really thin. Fewer resources lead to more deaths, actually. So more reasons to make sure we're social distancing and keeping those recommendations in place that we've received from the CDC. Also, one bright spot in all of this dark gloominess is that, more and more Americans are getting the vaccine. So that's good news. As of this past weekend, around 25 million people have received their first dose of the vaccine. That is about 7% of the country. Around 6 million, which is about 2% of the country, has received both doses of the vaccine. Every state has its own rules, its own regulations for distributing the vaccine. But in D.C., healthcare and long-term facility workers and those who are over the age of 65 and some essential workers can get the vaccine right now. In Virginia, healthcare and long-term facility care workers and those who are over age 65 and some essential workers can also get the vaccine. That also includes high-risk individuals. In Maryland, counties that have more decision powers, making it a little bit based on where you live, are able to get the vaccine. Generally, healthcare and long-term facility workers, those who are over age 65, and some essential workers are able to get the vaccine in Maryland. Compared to other states, D.C., Maryland, and Virginia are actually doing very well with getting vaccines into the arms of their community. D.C. is doing particularly well because we're at a 9% rate of, at this time, 9% of the city has actually received their first dose of the vaccine, and 3% of the city have received their second dose. So compared to other cities around the nation, D.C. is doing extremely well. But only 2% of the country and 3% of D.C. is fully vaccinated. So that's really not a lot. The rollout has been really, really slow. We've had a change in administration. So since President Biden has announced, since joining office or getting in office, President Biden has announced major plans to get 100 million doses of that vaccine in the arms of folks within his first 100 days in office. So that will put us probably by the end of April or so if he's successful in that. That would be an incredible feat, but some experts also argue that that's still not moving quickly enough. And that's if we want to get back to normal by the end of summer. So it's not looking too exciting right now, but people are getting vaccinated, which is good news. DC is doing really well getting the vaccine out compared to other cities. But, some more good news is that we may actually get another vaccine that's coming very soon. So Johnson & Johnson recently reported that its vaccine was 66% effective at preventing the disease. That's not as high as Pfizer or Moderna, which are around like the 90 to 95% effectiveness. But it's still a really, really good, percentage compared to what we see with most vaccines. And it would definitely help lower the community spread of coronavirus and also increase the availability of vaccinations or vaccines to the community. I bet some of you have also heard about different variants of the coronavirus, and you may or may not know what that means exactly. So, what is a virus variant? A virus variant basically means that, virus naturally mutate over time. So that means they're changing their genetic code at random. They're reproducing, and at that time, they're changing their genetic code. We call these mutations, right? So these mutations are considered variants because they're slightly different than the original virus that was identified. The mutations that we're seeing is giving the advantage to the virus at this time. So, for example, we've seen mutations that may allow the virus to spread more easily. Because mutations occur so frequently, there are probably a lot of variants out there, some that we may or may not even know about. There are some relevant ones in the British, South African, and Brazilian variants, and they're actually named after where they were discovered, the countries where they were discovered. We've only recently discovered these variants, so honestly, we do not know a lot about them. The British and South American variants have been shown to spread more easily than the original coronavirus variant, or the original coronavirus that was identified. The Brazilian variant also has mutations that allow it to escape detection by the immune system. So we should be worried about these variants because they all have made their way to the United States. And because of these mutations, there's a potential to cause an increase in cases, hospitalizations, and deaths. Also, we're not really sure how, the vaccine will work against these variants. So some evidence shows that the vaccines are not as effective with the South African variant. So Pfizer and Moderna are figuring out ways to actually solve that problem, if that really is the case. If there are any questions, feel free to drop them in the comments. I don't see any. All right, so again, I just want to add that, cases are still rising. We have to continue to practice social distancing. That means staying 6 feet away from people when possible. Continue to wear your mask in public. Avoid large crowds. Also, if you are able, work from home. Speak to your loved ones over FaceTime and instead of person. Social distancing is a way to care for your community. And so as a part of your community, let's continue to do that. Stay up to date on your local, state, and national guidelines for testing, quarantine, and vaccinations. Make sure you wash your hands for 20 seconds. And, of course, continue to follow us on Twitter, Facebook, and Instagram at Whitman-Walker. And also on those platforms at RealTalk_DC. Again, this was our COVID-19 update. I hope you enjoyed hearing the most and latest, greatest information coming directly to you from Whitman-Walker. If you have any questions, feel free to reach out, contact us. You can also visit our website at whitmanwalker.org. I hope you all have a great evening, and thanks for joining.